All right, Colleen, we'll turn it over to you for an update. Hold on, Colleen, you're muted.
All right, thank you. No, I just needed a second to accept the fact that this is being recorded. So I'm actually here at the Emergency Operations Center. I've got Kaylee back there maintaining more than 6 feet distance so we can be unmasked at this point in time. And so what we're seeing right now is an upward trend. We currently have 61 positive cases. We're actively monitoring 7. And so I would love to share my screen and kind of show the summary that the state had as of July 16th. And just to kind of see, where we're at as a state and just to kind of drive home some of those points. So if I'm able to share my screen, I will bring up this document, and it's just the summary pieces that I'll just be reading. So give me 1 second.
Sure.
So
we can see it, Colleen.
You can see it?
Yeah.
Great, thank you. And so we can see this is, the Colorado COVID-19 modeling group. There's a lot of folks involved. And so something that I think is important to note is as we come down and we just kind of look at the summary points, is kind of where we're at and some of the conversations that are happening, behind the scenes of, what our metrics are, when we as a county need to be a little bit more heightened and really emphasizing the piece that we're so interconnected, not only here in our community and by what we're doing in our, social distancing practices, but also what's happening in neighboring communities, as well as other communities that we rely on services. So just as a summary, I'm just gonna read out those bullet points that COVID-19 hospitalizations have been increasing since late June. The estimated effective reproductive number has increased over the past 2 weeks and is now estimated, is at the highest estimated value since late March. Social distancing has declined since May. So what that means is that a person who's now infected has the ability to spread it to more folks because of the fact, and the reason they're bringing that social distancing is because people are interacting, with more than just their household, right? We're currently in the safer at home phase where there's still opportunity to kind of move about the community and do some things in the great outdoors, as well as like going to restaurants. And we also recognize that, people are gathering in private settings, if you will, and not necessarily following great social distancing practices. Collectively, these data indicate that the trajectory of SARS-CoV-2, which is COVID-19, transmission in Colorado has changed over the past 2 months from a curve of declining infections in May to a curve of increasing infections. I can slide down to that figure if anyone's interested. Our more recent model results suggest the rate of increase has changed from slow growth to a more rapid increase in cases. Obviously, we can say that that is happening in our community as well, where we are finding that we're getting clusters where all of a sudden we'll have, 7 positives, then go a couple of days with, no positives. And we are, so since the beginning of this month, we have seen approximately, 20 new infectious cases, if you will. So we are following that trend as well. And then there's still obviously uncertainty about the rate of increase. The estimates will be more certain as we track the rate of increase over the next week. These are kind of the take-home points. If Colorado remains on the current estimated trajectory, we expect to exceed intensive care unit, so ICU capacity, in early September. If social distancing continues to decline, we could exceed hospital capacity in late August. Under these scenarios, without additional interventions or changes in social distancing, demand could greatly exceed hospital capacity. If social distancing is increased or other interventions to reduce transmission are implemented, the projected growth in infections and hospital demand is slower, and depending on the efficacy of these interventions, ICU capacity is reached in the fall or not at all. So basically, I just wanted to share that in the sense that, as we look at what's happening at the state level and folks are moving about and we're seeing this, not only here, but in the, media as well, in the sense of, where people are at, and people are tired, and we get it. And, I hear a lot of the question of like, oh, we're getting back to normal. And I want to continue to stress that we're not getting back to normal. This is still the new normal. Social distancing, wearing face coverings, in public, not going out when you're sick, decreasing your interactions with people truly is our new normal until we get to a point where we have effective treatment and or a vaccination. We know that that's off in the distance. So in the meantime, we are working behind the scenes on some triggers and some metrics that we can follow, not only what's happening here locally, but what's happening in the state that we need to be on top of so that we're not caught off guard. And if there's opportunity, for us to get some, information and some feedback now on, hey, if we have to start, slowing down, what would that look like, how people want to be informed. So we are working on some communication pieces around that, reaching out to specific groups and trying to just navigate, this new normal, as we say. So that's kind of where, we're at this point in time, and, feeling good as far as like community. I just want to say thank you, because I am seeing so much good behavior that's happening, outside in the community. And I think what we have to understand too is that sometimes someone gets just a little snapshot. Like there was, a complaint shared with us that someone drove through town and said that no one was wearing, face coverings. And I will share that that's not what I've seen. I happened to be in town on a Friday. So I was in town on Friday for more than, 2 hours walking up and down the main street. And I didn't, I was so thankful and so, encouraged that so many folks had face coverings. I don't think I saw one person who didn't, if they weren't, in close proximity, who didn't have something prepared to, pull up or actually had it on. So I think we have to be mindful and once again, approach this with grace with the people, in our community, that you might only be capturing like 2 minutes of, of behavior versus what's really happening, in the larger scale. Like we've had some complaints of, someone being at a restaurant and all of a sudden it just got packed in the sense online, and and that happened in such a short time frame, and staff or other folks didn't have an opportunity to like start being like, hey, we need to separate. And so I think we just have to do our best, approach it with grace. Everyone's trying their best, and if it's something that you feel that you need to let us know business wise, please don't hesitate to reach out. But I think the point that I'm trying to make is what you see might be just a small snapshot of the amazing work that's happening with so many of our community members who are pitching in and making sure that, they're doing their part. So I will end there because I know we're going to talk about budget here in a little bit, and totally open for questions.
Awesome. Thanks, Colleen. Does anybody have any questions for Colleen Nielsen at this time about the current situation?
Colleen, would you show that figure that was referenced in the
atlas? Yes, absolutely. And then I would like to share that Lisa was hoping to be here. And so we did. So what we're trying to do now with Lisa, recognizing that her schedule is pretty tight at times, is we did tape her this morning for a presentation, and then we will share that live, the link out here in just a little bit. And because it needs to go live on our YouTube site, and then we'll kind of go from there. But she will continue to do that presentation as we're tracking information. But yes, let me grab that. Give me 1 second, and I can grab it.
Yeah, and maybe this is if you haven't been asked this for this event, but we just got an email from the mayor that the community fund is going to request space for an event in September. Colleen, I appreciate everything you and the community continue to go through. And I have to be honest, I just wonder if we just nip that in the bud now and just not even entertain something like that. Because I'm afraid that, we keep creeping the doors open further and further, and there is no way to close that door again. From the feedback that I've gotten on the activity downtown, from my observation of outdoor, the recreation sites and whatnot, I mean, we are bustling, and it's, it's exciting for a lot of people. It's nerve-wracking for so many as well. Not only just community members, but business owners who, are just as exhausted as we are trying to navigate and manage what's continuing. So what are we looking at here? The trajectory?
Yeah, absolutely. So this is showing the trajectory of if we continue to decrease social distancing. So this is based on different levels and based on how many folks you can infect, right? If you're not meeting in large groups, if you're following social distancing principles, then the likelihood of you being able to infect someone is pretty slim. But if you're not following the social distancing principles, you get a higher rate of infection because people have the ability to infect more people. So right now we're kind of on the blue one. So here it is. So let me just make sure I say it right. So this is the projected trajectory of COVID-19 hospitalizations. We're talking specifically about hospitalizations. If Colorado's social distancing levels remain at levels after the full state transition, which is where we're at. So we know that that red line is not happening. We know that we're in June, that's the blue line, that's what's happening. And as you see us getting not so great at social distancing, right from the beginning, safe at home, moving into safer at home, we've kind of taken advantage and now we've gone up to that blue. But if we keep going down, then that will sharply curve up as far as that social distancing, if we decrease our social distancing. And right now there's some data out there, there's some mobility pieces that I'm trying to put together to kind of give another visual for folks to understand that mobility, happening within our state and from our state to other states, and even from, folks locally who are going to other states and coming back. And, and a lot of folks just trying to get, a handle on things and get some sanity in visiting family, but may not be following the best practices, kind of increases, our chances of getting more infections here. So it's just to show that it really is personal responsibility and recognizing, hey, if we can do really great at social distancing, that's the key. That truly is the key. And it's all the non-pharmaceutical, right, interventions. It's washing your hands, wearing a face covering, staying home when you're sick, ensuring, that you're remaining 6 feet apart, when possible, and not gathering in large sizes. And so to your point, Sarah, I think, we're walking that fine line. If we feel that we can do something well and we feel that it's community oriented and only for the community, then maybe that's something we should entertain, but it still has to be limited. And if folks don't feel that they can do that, or we're going to put people in a position where they can't effectively do that in the sense of, and I'm thinking this is probably revolving around like the community dinner. And I know in the past it's, everyone's at their own table, but then the intent really is for everyone to get up and socialize. And that wouldn't be something that we feel comfortable supporting in that respect. And so even now as some life, events are happening and, I hear some, stories anecdotally, like everyone started out really great at the wedding reception. Everyone had their mask on, everyone, did all these pieces, and then they had dinner, and then there was dancing, and then everything just went out the window, right? It feels good to get back into that crowd and do all these pieces, but not recognizing that, hey, that could be detrimental to some of the folks that are there if you are infectious. So I think, if the county wants to come together, we had that conversation with some special permitting like 2 weeks ago, and if it's something that, hey, we're not willing to entertain until we know, and because obviously the big push for us from the fall is really going to be, let's ensure that when our flu vaccine becomes available, that we get people vaccinated to kind of decrease that double whammy of flu and COVID. And so that's kind of going to be the big push on our end, but also too, if we're able to kind of come together and make that decision, saying we're not accepting, any, but we have to all get on the same page with that, right? We have to get on the same page with the city and, and the county in that respect. And right now, we have, and I recognize in our public health order, it's a little ambiguous in the sense of we're in this phase where we can gather in groups of 50, but yet being in alignment with the governor's orders, it says that, we can gather in outside spaces like up to 175, but that truly is trying to capture the whole entire state and big venues that actually have that ability. Because, the pushback I hear is someone's like, oh, well, I can use Ice Palace Park, and there's enough square footage with the calculator to allow us to, do an event of 175, but that means everyone's standing in their own square 6 feet apart, which isn't any of these events that I'm hearing. Every event is geared towards social interaction, which is a struggle, as we know. We know that that's where we're seeing infections. That's where we're seeing clusters of disease here in our community.
Well, and I think that if we, we can kind of prioritize somehow, kids going back to school. I mean, that's in and of itself is going to be higher exposure within the community. And so I think we have to try to balance, if we can figure out a simple way to message that and make that point clear to the community as to why, yes, we'll prioritize this and we'll manage this because we have the capacity, and we're going to put the resources towards monitoring and keeping on top of these things that are important, for X, Y, and Z reason. But we're not going to maybe entertain some special event as an example. I will ask, there are a couple questions in here, and Beth answers that of the positives, what are antibodies, and 38 are positive and 23 are positive antibody results, and they've not been counted or reported as new positives as of July 9th. I do wonder, Colleen, if we can start talking and understanding more about what we are learning from contact tracing, and, is this like, what can you share with us on age exposure, families, outdoor gatherings? I mean, I think that would be really helpful to monitor and kind of adjust our community behavior.
Yes, absolutely. So I think, the trend that we are seeing is that someone is infectious who is asymptomatic, so doesn't have any symptoms, and then interacts in a group setting, mostly in gatherings with family and friends. And so that's why we're seeing these clusters. Obviously there's some community spread that we recognize. I mean, that's community spread, right? You're just gathering and not recognizing it. We don't see it as like a pinpoint source of a business. Hey, this happened at a business. We have, all these employees and, who are exposed and or infected. We just aren't seeing that because I feel like our businesses are doing, really great measures to protect themselves and their employees. And so that's encouraging to me. I think, what the science is showing us is that, face coverings truly are one of the best non-pharmaceutical interventions that we have. It's also showing that being outdoors, because of the air exchange that's constantly happening, like it doesn't have to be a breeze, you just have to be physically outside, that, that's also decreasing the spread as well. But if you're outside and you're gathering with someone less than, 6 feet apart, and you're talking to them for greater than 15 minutes, and if they had it, you have a possible being exposed at that point in time. So the outdoors isn't necessarily the super safe zone. You still have to follow social distancing practices in all of these different environments. Right. And so when we think about, and I will share that we're not always getting cooperation from people, or also people are trying their best to remember who's at the party, but then recognizing it's almost like a light bulb moment for some people of like, oh my gosh, I went to this party and I only knew about 4 people there, but there was probably like 50 and they can't identify anybody else. And so, then it becomes, a little bit of detective work, and also, hey, anyone can you just get them in contact with us? Because, the key also to decreasing spread is, finding out who is positive, reaching out to all their close contacts. And granted, in a party scenario, you might not have been in contact with, all 50 people, but the person that, you always think of it like, hey, if I talk to this one person and that person talked to one person, that talk to 2 people, like. Yeah.
How are these people coming to get tested if they are asymptomatic? What's triggering them to come in to see you?
So what happens is that then someone becomes symptomatic, but we know that they are shedding the virus prior to getting the symptoms, and they have the ability to pass on the virus before they have symptoms. And so that's usually what we're seeing. We're seeing when folks finally have symptoms, they come in, and then what we are doing, we are testing close contacts that are asymptomatic at that point as well. So we do have that ability to test those folks if they are identified as an exposure, if you will. And that's like to check for that is my symbol. If you haven't already figured out, that's the nasal swab. That's the PCR test that lets us know who has an active infection. Muscle memory, little habit. And so I think, it's just, we did push out some messaging around the antibody ones. And the reason is we found that so many of our antibody tests that we were following up with were sick in March, and that actually isn't helpful for us in July. And that's a lot of time and effort to kind of figure that out. If we know that they were sick sooner, then that is something that, we do follow up on and go from there. So we really want to be mindful of truly tracking our current infections versus just capturing what's happening, what's happened since we started tracking this. And so Lisa's data continues to show all of the testing and all of the positives, both in antibodies and in PCR. But as we report, we're only reporting our active infections
Right. Do you, oh, am I not muted? Oh, I am unmuted. Do you, sorry, I was just trying to get that, that document that Beth shared there, but what of the, at one point, I think there were 5 antibody positives and 300 and something had been tested. Is that ratio still kind of remaining the same? And really we're,
No, so I don't have that. I don't know, Beth, if you can pull it up quick about how many tests we've done to date, but we're definitely over 300 for the antibodies as far as testing rate. What we continue to be at a rate of is what they call positivity. So that's like the amount of folks that are actually, sick and or positive against the amount of tests that we've conducted. And I know that we're over 1,000 tests at this point in time. And so we still sit at a positivity rate between 5 and 7. The state would like us to be at 5 or below. And that kind of talks about the opportunity to move into the next phase, which is protect our neighbor. And that will, we are not alone in our inability, if you will, to just jump into the next phase. And I appreciate that as well, because what we're doing right now is kind of gearing up. We're going to increase staffing so that we're kind of prepared and we get folks prepared for the fall and what's to come. So I don't know if Beth just shared that. Okay. Oh, there it is.
I'm not having an easy time just downloading that.
Yep,
but
give me 1 second. Let me see if I can
work
get
better here.
All right, give me 1 second. Let me see if I can grab it for us. Because I can't see it until I open it.
So Colleen, of the 7 qualifications, I guess, is what it would be for us to move in to protect our neighbors, what of those do we currently meet as a community?
Yeah, let me grab that here in 1 second. Hold on. Sorry, give me 1 second. So I am just going to share my screen of all of the latest testing so you guys can see it. And it looks like Beth just put it in there, but that's where we're at this point in time, if that makes sense. So the antibodies were up to 746 tests at this point in time, and PCR 556. Okay, so if we're good with that, I can talk about some of the metrics. So let me unshare my screen if we feel good about that. Yes, no?
Yeah.
All right, so as far as protect our neighbors, we have the first 2 metrics are specific to the hospital. It's recognizing, trying to think, it's talking about capacity and where we're at, as well as what the med-surg plan is, as well as there has to be a patient transfer plan in place. We recognize that here in our community that any critical patient that we have has to get transferred out. And so that is something that we know the hospital does have in place. It's just a matter of getting it all organized and make sure that we understand what all of those different transfer points are. Hence why when we talk about there's a data system behind the scenes called EM Resource that all hospitals, specifically in the ER, has to have like their bed capacity up, has to say whether or not they can accept new patients, and if so, what kind of patients, as well as, hey, we're on divert, meaning please do not bring anyone here. So that's something that the hospital closely monitors. And that's something we follow, through them as well. And so we feel confident that we can meet those metrics, showing that there is, relationships and partnerships in place with the hospital, with other facilities. The next one is that no more than 2 hospitalizations in a single day during a 14-day period. So we currently meet that. Knock on wood, we haven't had any hospitalizations since April. We continue in that trend. I think that hesitation in this one is we do know that with influenza season approaching quickly, if you will, that what we have found in so many cases that there were folks who had influenza as well as COVID-19. And so we do know that we can support some folks locally, for some of their basic needs, but if it's truly a critical need, that's when we need to transfer them. But as you can imagine, that's a really low threshold. It's not unusual for us during flu season to have 2 hospitalizations in 14 days, because what happens a lot of time, people just need like a night to kind of catch up, get on oxygen, kind of get some support, and then be able to go home the next day. So it's kind of a tough one, if you will, overall for us. And like I said, this is only based on our population size, hence why our thresholds are pretty small. The next one is, let me see if I got it. There's also to develop a threshold of concern for new admissions in a 14-day period. So basically that is what we're working on, to think, hey, if we think that 2 hospitalization one isn't really the best metric, can we propose one where we can look at where we're concerned about as far as hospitalizations here in the community. So the next one is that we cannot, so this is metric 4, and this talks about our positivity rate as well as how many cases we have. And so for this one, in all of these metrics, they're giving you like A, B, or C to try to fit which one might be the best for your community. And we kind of are waffling between a few of them, but basically this one is the, when we talked about, if you remember way back when, and we're still using our, roadmap to recovery, our green, blue, and black diamond, we're in the blue square. And so one of the pieces was, no increase in cases over 14 days. And so what they're looking at is that for us, that we can have no more than 7 cases in a 14-day period. And so that's a pretty tight parameter, and we're not meeting that right now. In July, we pretty much are seeing, even though we're seeing them in clusters, but we've seen about 20 active cases since the beginning of July. And even if you want to say 1 case a day, we still aren't meeting that, less than 7 and or 8. Kind of, we want to push it to 8 because we kind of sit at 8 every 14 days. That we're not meeting that currently. So so far, we're not meeting that metric, as well as the positivity. They want it to be 5% or lower, and we kind of waffle between 5 and 7. So the next ones that we are meeting is that we have to be able to conduct, for our population size, about 15 tests in a day. And so we are able to meet that because we do have that capacity both at St. Vincent Hospital as well as Rocky Mountain Family Practice to test people. And so we are able to meet that metric. 6, I don't have it up in front of me because I have my note saying that, hey, we met that metric. And then, but I think the next couple are all about contact tracing. And so I will be able to speak to that because I don't know which one that exactly meets, but we have to have the ability to contact positive cases within 24 to 48 hours. For all of our cases at this point in time, we are actually under the 24-hour threshold. So basically, we do have people on call. We have people, after hours as well as on weekends to ensure that we are able to reach out to people as soon as possible. So we are meeting that metric. And then it talks about our ability to contact trace, which is kind of fun because we're so small. Our number, if you break it out, is 0.68. So less than 1 person we have to be able to contact per day. And we recognize that, sometimes we are literally contacting, 7 cases that all came in at once. And so we are able to, meet that at this point in time. We also are bringing in, we have about 6 or 7 nurses that do not work for the county that have volunteered their time. We'll talk a little bit more about that budget, after this, that we have on standby, ready to go. Some are bilingual, so we're trying to ensure that we're meeting that need. And then we're also looking to hire another part-time contact tracer that can truly be monitoring a lot of these pieces. So we are meeting some metrics, but as you can see, some of the other ones we're not meeting. They're so fragile in the sense of we might be able to go down 2 cases, but it would only take another week to go back up 4. So to move into that protective neighbor phase is, something in my opinion that's not going to happen, for a couple of weeks until we really see if we can kind of squish, some of these infections and really keep pushing people to really be mindful that, if we continue the way we're going, and this is as a state, right? We're seeing that people are just social distancing. Each week we're getting worse and worse. We're just going downhill as far as social distancing and folks throwing around the word like it's normal and it doesn't matter and everything else, not recognizing that if we continue in that trajectory, we're actually gonna have to start moving backwards. And that's what we're trying to figure out right now, what that might look like for us here in Lake County.
So trying to figure out what it would look like for us to go backwards, you mean?
Yes, I think we're in a really good, stable phase right now. And if we, and I think when we look what's happening in other counties in our region, like we're doing the best, if you will, overall in our South Central region for our social distancing practices and our mobility, so that, so we already know all those practices. The state would like us to be at 65%. We as a county are at about 40%. At this point in time. So we're not quite hitting it, but we're not the worst county in our region that's below 20%. And that's kind of one of the larger counties that has a lot of movement, and people are just, are just kind of free-for-alling, if you will. So we will continue to push that message. And
Can you tell us where that is?
So it is a very metro county. It's El Paso. They're
Okay.
struggling.
Okay. Colleen, what's the turnaround time on testing?
That is a great question. I was going to bring that up, Kayla. So something that we're seeing across the state, and it's not just happening here, is what went from a 48 to window is now getting expanded to anywhere from 4 days to 10 days, depending. And, when it hits the lab, how it hits the lab, who's come in before you, what group came in before you, because what's happening is a lot of the private labs here in our state are now being utilized by our neighboring states we know, like in Texas and Arizona, that have seen a huge increase. So those labs are coming across state lines. And so we're kind of working, as a state to figure out like, hey, what do we have to accept? What can we prioritize as our state? And go from there. So I know there was some talk about, like in Denver, I got my, results within like 2 days. And I'm going to tell you that meeting with all the public health directors, that every single county is being infected. Obviously, we have a little bit of a delay because of the need for a courier to go down into Denver. But the reality is that it's affecting, all of the counties across the state. And, I just remember Larimer talking, very strongly about like, hey, we're in Larimer, we're so close and we have all these resources, yet, we're still waiting 7 to 10 days. And so when you think about that, so much of the data and what we're seeing, we're always going to be 2 weeks behind of what people's behavior is, right? Because it takes about 2 weeks for people to actually get sick, or, up to 2 weeks for people to show symptoms. And therefore, recognizing that our data is never exactly what's happening right this minute. We're getting data that happened, 2 weeks ago or 3 weeks ago, not what's happening now. And if we already know that we've been on a decreased trend of social distancing, then, we still, believe it or not, and I think the state will recognize that, we still don't know what the effects of 4th of July are in some areas because of the wait for testing, if you will. So stand by on that. I think there are, Lisa jumping on, and I think there's also some places that do have rapid testing. And so some people can get results right away. That is not something that we have here. And so, and the accuracy I would share is not as effective as some of the other, like our PCR test, to know of active infections. But if Lisa, you want to speak to that at all, feel free.
Yeah, I'm sorry I'm late, guys. I appreciate your patience. So there is rapid testing at major hospitals, which means that you can get results within 24 hours. However, because of limitations in reagents that are available for those particular tests, they're limited to the critically ill and people who need emergent surgery. So those tests are not available to the public at large. So you can't get a test result in Colorado for a non-emergent case in less than 8 days. As of today, it changes a little bit periodically, but some testing forums unfortunately can go up to 14 days now. So we are in a bad way with what we can do for testing, but we can, I think, hopefully be able to get that down. Right at the end of June, we were getting results in 48 hours, and that's the goal again. It will just take a little time for the private industry to flex and be able to get more testing capacity, but there is no such thing as a rapid test for someone who is not critically ill or needing emergent surgery.
Thanks, Lisa. So we've got a few questions in the chat box here that I just would like to read in and see if we can get any clarification on. So one is, do we have any kind of sense of what type of messaging is needed about wearing masks, or messaging to visitors about wearing masks, or enforcement in local businesses? And then if the influx of visitors is creating an influx of tests in our community, or if those tests are being reported only for locals. And then a question around if someone receives a flu shot, will it create a positive antibody test?
So I can start with the no. If you get a flu shot, it has nothing to do with COVID-19, and so it will not create an antibody positive test to COVID-19. It will to influenza, but not to COVID-19. And then, you know, the messaging, it's pretty clear. You know, if you wear a face covering, your chance of either getting the COVID-19 or transmitting COVID-19 is reduced by over 90%. So I don't know how to make that more clear.
Well, I think it's been helpful, true, that obviously now as a statewide order that, you know, for wearing face coverings, that has been pushed out. I think that's, you know, coming out from different tourism agencies, you know, as well as here, you know, locally and all that other stuff. But if there's other creative ideas that we haven't thought of, you know, obviously we continue to use social media and, you know, is our biggest platform, if you will, as well as, you know, opportunities to speak to folks and educate folks, you know, on one-on-one. As far as the enforcement piece, that's still, you know, the hard part, in that, you know, so much of this is personal responsibility, but businesses do have the opportunity, if they feel that, you know, somebody's come into their establishment not wearing a face covering and they ask them to leave and they refuse to leave, then they have the opportunity, that's trespassing on private property, and they have the ability to call law enforcement. Obviously, the capacity of law enforcement, I can't speak to that. So I just know that that is one opportunity for public. And then obviously other enforcement pieces that people talk about is, you know, if we are finding that a business is not adhering to public health orders, and you know, there's some licensing that's required of some businesses, but I would share at this point in time, I feel like folks have been really great, even when there's a phone call and some education given, like we're just not there yet, and I'm so thankful for that. So thank you to all those businesses that are out there protecting themselves and their employees, as well as our community.
The vast majority of tests that we're doing are on locals, not tourists.
Great, thank you. Does anybody else have anything to ask of Colleen and Dr. Lisa? No? Thank you both so much for joining us today. I really appreciate it.
But again, I apologize for my tardiness. You have a good day.
That's okay.
And
Thank you,
Lisa, for, you know, posting your message and getting that out today. So thank you for your time earlier as well.
There's actually a couple other questions.
Oh, go ahead.
Should I
Yeah,
answer
go
those?
ahead. Sure.
So do locals work in Lake County or other? We have not been tracking that. At least I have not been. I'm sure that Colleen, during her contact tracing, knows about where they spend most of their time. So I can't answer that. And then to clarify, positive results are reported for the county of residence of the patient. And yes, that is correct. So if you are positive and you are visiting from Denver, that's a Denver result, not a Lake County result.
Thank you.
But I would just add to that, that if, you know, if that Denver Public Health Agency felt that there might have been a high risk exposure here in Lake County, they will share that information. It's not like, oh, this person was at this party and they were at this wedding and we know there's like 5 more people. Like, we will be informed of that to follow up with anyone in our county that might have attended like an event or something like that. So there is collaboration happening between counties. It's not just lost. Like I said, that's why we do the interviews and we see where folks have been moving about. And if someone's like, no, I just stayed at my hotel room and then I only went out and hiked, then they're not, you know, they more than likely, you know, didn't have an opportunity to infect anyone else.
And I should clarify that the state data does by county of residence. If you're looking at the local Leadville County data, we're just counting number of positives. And so if you were from Denver and you were visiting and you were positive, we would count that as far as a positive test. And so that's why there's a little difference between the state data and the Lake County data.
And that's the data that Lisa's keeping. So when we report positives out on social media, we are only reporting Lake County folks. That's why, like, I know it still continues to be confusing overall as we continue to like refine our processes.
All right, thank you everyone. Have a great day.
Thank you.
Lisa.
Thank you, Lisa.
We'll jump into some CARES Act conversation. I see we have Paul Anderson from the school district with us. Sarah, do you want to, I think you've been in contact with Paul. Do you guys want to start with school district and then we'll jump over to Colleen and Janine?
Sure. I you know, have mentioned a couple times and kind of anticipate a high need to address our unemployment stats and our individuals who remain unemployed into the winter season, and also believe that we need to be working with the school district hand in hand if we are not already. So I asked Paul if he could join us to help us understand, where they're focusing the funds that they're receiving and where we might anticipate kind of a need for a collaboration with the county. Thanks for joining us, Paul.
Great, thank you. Thanks for the invite. Bethany definitely wanted to attend, but Katie Anthus is addressing the state, hopefully coming out with more threshold information that will then be more guidelines on how we and what levels we are able to return to school. So once we know that, I'm sure Bethany will be very excited to meet and go over that stuff. But honestly, the biggest ask right now from the school district would just be continued collaboration and being a partner in the decision-making process, because it is a community-wide issue. We've done a survey in May, as well as had a COVID task force among teachers and admin staff, and then also did a recent survey over the past weekend to just get a sense of where people currently are. And it is very mixed. It's very 30% disagree with the plan we've kind of tentatively rolled out, 30% are neutral, 30% agree. There was no clearly, every option was very well represented. So I guess that's the scariest part, or is just that there isn't a clear path forward, and we need all stakeholders really at the table making the decisions and moving forward, and how we do it wisely to best meet the needs of the community. So we have been working with public health under guidance from Colorado Health Institute and American Pediatrics, some of the guidelines that have come out, and really, in going forward, busing is kind of going to be hardship only. We're kind of asking, with the current plan and what we're projecting right now, that most folks would bring their kids to school, drop them off, pick them up, and the buses truly are for those not able to get the transport, because that seems to be, I guess in past years was, say, 450 students a day utilizing the buses, and would be and is a major source for transmission. So that is a known point of how many trips can we feasibly make, and the timeframes and just the logistics of busing. So that was part of the question that went out, is how many will need it. Does look like it is a much reduced number, but and really for the transition back to school, we're looking at a 3-week kind of cohort scenario where there's A and B, or whatever you want to name them, splitting the classes in half to really reduce the class size. Say class A or cohort A would be in the building, cohort B partnering with Get Outdoors Leadville, or Becca Katz has been in discussions in how can we create kind of an outdoor cohort as well to increase spacing and just reduce the chance of transmission. So with all of this, I think no matter what really the plan comes down to, it'd really be a joint public rollout between public health, the county, the school district, and just really relaying out what the plan is, what the parameters are to transition to a more strict, or either more online or more in school, in person moving between those levels of that are being planned. You know, what those thresholds are is still up in the air, and we don't really have anything to release at this point. So as those get defined and we move closer to opening day, you know, a collaborative effort to roll out the message and really have something that the community can rely on, that's been well thought out, and go from there. So as far as funding, I guess that was another question. We have purchased, placed a big order today for additional cleaning supplies, and including hydrostatic foggers, like a sprayer that can sanitize classrooms, buses, really a more effective cleaning method to deep clean after each day, or every Friday we do additional cleaning, or however that works best based on the site. And there's just masks. We're getting buffs for all staff and students. Clear masks that teachers hopefully will be able to talk through, and students have a better means of understanding what's being said with being able to read the lips and stuff without just a face covering that really hinders the learning process. So some of those things, additional training days with the principals are coming back several days ahead of normal contracted. So paying that out, teachers have 3 additional training days beyond their normal contracted time for really transitioning back to teaching, and purchasing more software and education materials that allow for possible online learning if we're part in school, part at home, or really trying to think through how is our education system just changing, and probably for the long term may not be just a 1 or 2 month change. It's really there's a lot out there, and trying to effectively pick which of those models work well with our system and the expeditionary learning and can fit into our modules. So are there specific questions?
I'm wondering,
Paul,
Colleen.
Go ahead, Sarah. I have a quick question, Paul. Is there any consideration of, well, I guess I have a couple. Do you have funding for, or do you know if there's a need for supplies for students to be, to work in an online setting? Like what's the need with students to be able to do online learning? And then is the task force considering anything like potentially like a year-round schooling model where you're in for a couple weeks, out for a couple weeks? Has that been considered, or is that a thought? And then trying to understand what that impact would be on additional childcare in Lake County.
Yep, I would say there's at least 3 to 4 different types of models being, fully at home, worst case scenario, no one is allowed to go to school, or I think that's red. Green is everyone's allowed back, we're fully in the building, and then kind of 2 in between models where if it's the A and B cohort, Monday, Wednesday kids, Tuesday, Thursday kids, since we are going to a 4-day calendar this coming year. And then it's, also discussing higher needs folks and who prioritizing who really needs the in-person, or, there's kind of the whole array, but honestly, we're hoping, and we've heard, I guess, that there will be some guidance coming out from the state. And I believe that maybe Katie Anthus is doing that right now, as far as what those thresholds are, what the number of students indoors will be, and some of that we don't have specific guidance at this point. And I think it'll really come down to what is happening at a local level at the time we're returning to school. You know, it's still, we're projecting a month out with 2 to 3 week old data. So it's very much, we have to be planning for many different scenarios and able to adjust based on what's happening here at a local level without, you know, that's just the reality of what we're faced with. Was there more to that question? I guess, have I missed?
No, I think that's all that I had about that. It was just, you know, is there the potential for a model around, you know, like maybe year-round schooling to be sure that children are equitably getting access to education and classroom time. And then just wondering, you know, what the technology needs are of the school district for any kind of hybrid learning model, or if any CARES Act funding from the school district is being used to purchase those technology needs for students, or what that looks like.
Very much technology. I did forget to mention that, but we have purchased upgraded servers as well as transitioned all of our email to Office 365 on, you know, in the cloud. So the ability for teachers to access their tools and things they need to function is improving, as well as technology. We've gone one-to-one devices from K through 12. So we have iPads for kindergarten and first, as well as additional Chromebooks purchased for all second graders. And then 3 through 12 were already one-to-one devices. So that will help with, you know, the ability of kids to have the same device if they're at home as compared to what they're working on in school, and access to some of the same learning tools that are being in the classroom. They're signed in. Hopefully nothing is new if they're having to stay at home, and if it's for 2 weeks or, you know, extended, their sign-in should be the same, and just more consistency no matter where they are doing the learning. So that is one of the biggest, let's say technology is the biggest area that we've really addressed and upgraded to get to one-to-one for all students.
Thanks, Paul. I don't think that I have any other questions. Sarah, do you have any questions?
I'm wondering what, you know, and this might just be a matter of trial and error once we get our, you know, both our feet, all of our, into getting back to school. But as far as contact tracing or, you know, working with public health, have you all and maybe this is for Colleen, do we feel like we can, you know, meet that demand as best as we could project it should cases start occurring within the schools?
Yeah, so at this point in time, you know, as we know, it's not like you all of a sudden get 15 cases at once. And if we did, that would be very challenging in the sense of, you know, and if it was all from the school, then that would be considered an outbreak. And right now, as a county, we haven't had any outbreaks. We have clusters. And so, you know, part of the piece into, you know, Paul's point is trying to figure out what would work best in the sense of, you know, the big push that they keep talking about on the national level, the state level, is, you know, that cohort piece. The more that you can keep kids together, you know, and not having them intermingle with all other groups, the better, in the sense of too, because say there is, you know, somebody who is, you know, infectious in that classroom, then, you know, we might be looking at 15 students going out on quarantine, if you will, because they're not, you know, they're not sick, so we're not isolating quarantine, versus, hey, we had, you know, the student that now had the opportunity to be in 8 different classrooms, you know, in the past week when we knew that they were infectious, as well as interacting folks, where that takes a lot more people out of the picture. And so, you know, on both sides of that, like, cohorts really help us effectively, you know, contact trace, as well as, you know, keep the systems moving, if you will, versus having this freedom to move about, all the schools, and then therefore, having an opportunity to, come in contact with more people instead of like your tight little group. But I think, so much of this, and to Paul's point, and, I just want to do shout out, the district's been, working so hard behind the scenes. And even now, like, I know that Beth shared the guidance, and so much of it, is vague, if you will, like giving you some good parameters that we can start with, but feeling like, hey, we might be able to do this really well, but not this piece. So what does that mean, as a school district? What do we think is going to be really effective? And, there aren't thresholds in there. That's something that we have to come up with, of where we feel comfortable, where we're at. And so I know that's, some of the behind the scenes triggers and thresholds that we need to get to and agree with is going to be happening very rapidly in the next 2 weeks.
I think the only thing I'd add is it looks very different, even K through 6 compared to like high school.
Yeah.
And I know those are some of the conversations happening across, bouncing ideas back and forth between the principals is, what works for West Park and LCIS may not be practical for the high school, and really adjusting based on each site what makes sense for them. And we'll see, how those discussions play out. But that is being discussed. It's not, oh, my kid's in 6th grade, it's the same as the 12th grader. It's very much for their schedule, how it affects them. So
no, I think, Paul, that's a great point. And like, that guidance reflects that. And, and I think this is an opportunity, right, for all of us, to be creative. I've had, some folks reach out to me, in the educational, world, who are just like, well, how am I supposed to do this? And how am I supposed to do that? And I was like, I'm not an expert at education or coming into a classroom or even understanding, the flow or, how that all works. And so I think, it's up to each of us to kind of come to the table. And I know this district's been, asking for those pieces, for, everyone to kind of be in it. Like, we're all in it together, and none of us have like the upper hand of like, I know exactly how this should happen. And so, the more that we're able to kind of communicate and kind of throw out like, in a positive way, like, what are some of those ideas? Will that work? And like, to Paul's point again, like, hey, that'd be really great. Like, we know, for example, like in pre-K, like they are the best hand washers out there, like hands down, like best hand washers. You get older, it just kind of gets worse and worse. You're no longer singing the song, you're doing faster, and so we know that for them to wear face coverings is probably not going to happen. But man, if we can get them to wash their hands really well and keep up, that's really great. But for high school, like, not so sure they're doing great hand washing, but man, they can wear some face coverings. And let's, to Lisa's point earlier, like, we decreased that by 90%. Like that's amazing. And so I think, a lot of conversations happening, a lot of moving pieces, and recognizing, the value that, bringing kids back into school, is so much bigger than just like one educational slice. It's, social economic, it's, nutritional, it's, educational, it's, it's just so many things. And so I think to your point earlier, Sarah, was like, is that our goal as a community, is to work together to ensure that we can, get our kids safely back in school, whatever that model looks like, to start with, and then, figure it out from there, versus, hey, we just have to shut it all down because we're not doing great as a community, if you will. So.
Thanks. I appreciate that, Colleen and Paul. Sarah, do you have any other questions right now about school, or do you want to dovetail this into chatting about our CARES Act funding and potential uses for that?
Yeah, I think that's just part of my question that's up in the air, and I don't know that Paul has specific requests, and I think that's, in my head right now, a lot of our funding is going to be kind of earmarked for the unknown. But I anticipate that in the continued collaboration with the school, we'll figure out if there are gaps that might need to be addressed.
I think one unknown for me would be the meals program funding, in that we are able to do breakfast, lunch, and dinner clear through August 15th. Partly, dinner's funding went away as of June 30th, but through athlete registration donations, the Lifetime Foundation is sending a $66,000 check to fund the dinners July through August 15th. So we are covered till then. I don't know how the funding, it changes the day we go back to school. And if we were to go back into a full-on quarantine, how funding would look, and if we'd be able to continue with 3 meals a day, 5 days a week, like we have been through this whole summer. So that would be one unknown. And, you know, going into August and September, I guess, would be you know, we might have better clarification by September 1 or something.
Okay. So regardless of that, you'll be able to provide lunches though, breakfast and lunches?
Yeah, I believe everything will go back to normal as though we were in school funding like it would have been last school year. The unknown would be if we were to go back into a full-on quarantine situation, whether federal funding would support us like it has through this summer until June 30th. So,
Well, do you feel like the district would base the assessment of that need on the collection of data from families? Or would you presume that that is a need?
I have heard from many families how thankful they are and reliant on the food, just in that their kids are home 3 meals a day.
Yeah.
It's a big need. You know, I don't know percentages or that, but many folks have reached out and been very thankful that the program has been as well funded and supported the way it has this summer. So, and that's many organizations have helped out, and donations from many as well. So, you know, it's been a huge collaborative effort, and I'm glad the schools have been able to kind of be the main hub of that, but have to give credit to a lot of folks that have donated time and effort.
Do we want to go into
Yeah.
the proposed or the shared budget? Janine and Colleen.
Janine, what's the pandemic EBT that you're referring to in the chat?
Sorry, I had to unmute myself everywhere. Pandemic EBT will be starting in the next week or so. That is $279 per child in the household for all children who were enrolled in free and reduced lunch. And it goes directly onto their EBT card if they're enrolled in SNAP. If they are not enrolled in SNAP, they'll have a card sent to their home, and the funds will be loaded onto that card. Families who don't have enrollment in free and reduced lunch can also still apply through the Department of Education. So that is based on federal funding that's available for children, for food access for children of school age. So that will be coming. We don't know how long it will last, but that will definitely be helping through the month of August. And it covers, the reason it's $279 per child is because it covers the 40-some days that they were out of school. So they estimate how much it was per day.
Okay.
In the spring.
Thanks, Janine. Sarah, I'm sorry, I didn't mean to cut you off. So if you want to talk through our CARES Act funding now.
Me? Did you say Sarah?
Yeah.
Oh. Well, Janine had sent us that budget. And I don't know, I mean, there are a couple things to observe off the bat is that it's not taking into account the split between the city. And I don't, you know, I have a couple of reactions or comments that I wrote down here. But I guess I'd like to go through some of that with Colleen and Janine commenting.
Yeah.
and understand where we are not already kind of addressing some of these things, and if there are items in here that they intend to be kind of a reimbursement of sorts of priorities that we've already identified.
So the county allocation would be 516, oh, sorry, that's not right. Would be $579,669. So we split the 697,000 with the city. The city took 17% and the county retained 18%.
And I think before we do a deep dive, and Janine, please feel free to jump in, is I think it's important to recognize that this was just a preliminary conversation of, hey, where would we think it might need to go? Recognizing that, hey, we don't have all the answers. There isn't a process yet to, solicit this information from other places to say, hey, this was just us, and I should say Janine, put it together. And I thought, having some of those conversations, we're like, no, that makes sense. That makes sense. In the scheme of it all, just to kind of give you a visual of some places to be thinking about, but not saying that this is what has to happen, that this is, where we want the money spent, just to say, this is what we're thinking about. And obviously you have so many other, demands, including the city, and what does that look like? It's just trying to get that ball rolling. So we're not at, December 1st and we haven't figured out how we're spending it, and it has to be spent by the end of December. So it's just trying to put something to paper and a process to boot as well. So it's not, as you can imagine, it's just outlining things right now. Janine, did you have anything to add?
No, that's the, as needs were coming up, just trying to sort of tally what we were hearing in the community as needs that were coming up, and things to think about. So wanted to just put it all in one place, so you all could evaluate that. And, as we go through it, I certainly don't have a sense of exactly what some of these things would look like. Just want to make sure that we capture it and that we don't later go, oh yeah, there was this thing.
Yeah, no, totally agree. And I appreciate the work that you had both done on having that conversation to bring that to us. I think that was really great to prompt this conversation. Definitely. So I think, talking through the CARES Act funding, we should think about this in approaching it in two ways. One is looking at and approaching the immediate needs, and then looking at the long-term sustained needs, right? So we know in the long term that there may be a sustained need for another round of grant programs to our businesses that may have been affected through the tourism piece in the summertime. So we might want to consider that as a long term to get those businesses through the winter months. And immediate needs may be PPE or face coverings for businesses, or an additional order of hand sanitizer for businesses. And so that's kind of how I'm looking at that, because it is such a short time frame that we have really to allocate this money to recovery.
Yeah, so definitely thinking about, you always want to make sure that you have in mind when you have money coming in, how you're going to be able to spend it in a realistic way. And so again, even the details of how this would work, we need to make sure it can be efficient and effective. Do you want to talk through each one? Are there items on here that you feel are important that you don't see, that aren't on here, or questions?
Go ahead, Sarah.
So I think conceptually, I just have some comments on, well, I'll just start going through it line by line. Do you want me to share my screen and the document, the drafted document that we have? Hold on a
Sure.
second. Okay, I'm sorry.
Can I just ask what's the status of where we're at, and is it confirmed? And you
It
all
is.
have-
Yeah, so we have confirmation that we've been awarded the full dollar amount.
Okay.
I'm sorry, this is taking a while here.
It's okay.
Okay. Okay. Oops. Okay. And I think, I mean, again, yes, just the conversation of how we're going to look at this, right? And that recovery grants to business as the first line item. I think we have to, it's so hard that everything is up in the air, but through the recovery process and the business advocates and, you know, the winter season, do we anticipate a lull because we'll have a spike, or do we anticipate like insane amounts of visitors as we are seeing in the summer? So looking at investing, I think for me, the recovery grants to businesses is also synonymous with earmarking some of those funds for the unemployed community members in Lake County, to kind of just be ready for how, you know, both of those groups have adjusted, or you know, what the fall and winter brings. As far as staffing needs, I think we definitely need to look at continued staffing, not only in human services and public health that we may not have already addressed, but across some other key county positions, so that we can maximize existing roles in function, and overall look at, you know, investing in efficiencies so we don't continue to get burnout. Case management, I really like. I also wonder, in like that kind of vein, if we, as far as that support to businesses, that those ambassadors, and Colleen, you said you walked up and down the street the other day for a couple hours. I think we all could do that every day. Not hit, you know, not be able to make it up and down each side of the street, and never get our other work done. I think that that's one thing I've heard from folks downtown, just to have more of a presence of people who are kind of on their team, communicating with visitors. Overtime for exempt employees, this is something that we can do through FEMA, and I think that we need to also communicate as a board the expectation throughout the organization of, you know, how we are kind of prioritizing our time, and then kind of linking this with appropriate staffing, so that we don't have this overwhelming overtime demand. Although I'm sure that, you know, maybe with public health and human services, of course, we may always have that. So I think I'd rather not anticipate the overtime, but figure out how to properly disperse the workload that needs to be addressed. Chris Floyd writes, I presume the entry in the budget for overtime intended to be for non-exempt and not exempt, since exempt employees are not typically paid overtime. Chris, I think that's kind of what we, you know, looking at this, it's probably more of a board discussion on what we want to budget for. Typically, I think you're not looking at a pandemic and an extended period of time, and you're looking at a wildfire, and FEMA does reimburse for exempt employees that are, you know, operating 24/7 in those shorter events. And so we are working right now to submit to FEMA within a period of time to see if we would get that overtime reimbursement for exempt employees. But that is one I don't think comes to the top of the list of priorities of CARES Act funding specifically for me. Any comments or questions, or anyone want to interject before we keep going?
Just real quick, I was going to offer that the reason I brought that up is it may be, you talk about supplemental payments to exempt employees, but you need to be cautious about using the term overtime, especially if it's calculated on an hourly basis, because that runs the risk of impacting the exemption for exempt employees if you're treating them as if they're hourly. And so it'll just be some of it in terms of how those payments and supplements and such are defined. I just want that to be on the radar so we don't inadvertently create issues.
Okay. I think we've kind of briefly chatted about continuing any kind of PPE for businesses, which I think we would be happy to see how we can continue support there. Childcare has definitely been a big need, and I think in collaboration and partnership, or however that plan may unfold, with the school district potentially, I'm not 100% sure. Definitely an economic need and need within families. Communications, recovery, and marketing, there I think we could look even more strategically. I'm sorry, I'm reading the chat. At leveraging lodging dollars rather than CARES Act dollars, potentially. I guess just on other, I see the Sims here, which is something that had been brought up by Judge Seamus as well. Forgive me, Janine or Colleen, if this had also been brought up in public health or human services, but as a kind of collection and education and outreach piece on the justice system, or the needs and direction and priorities set within the courts and probation and law enforcement. I think that we should support something like that. And I also think that we should take advantage of, there's some other grant opportunities that if this funding may be leveraged for, great, or if we can supplant and use this funding for some of these things, but continuing those investments on other revenue generating aspects, so that we can mitigate the impact on our budget in general, never mind through COVID.
Hey, Sarah, it's Colleen. I think, there's opportunity, right, for so many different pieces. And so, like I said, like this is just a framework, and there's other folks who've, come to say, hey, this is what we think our need is. Then I think, it's important to capture like what that process is. Like, obviously we threw in $100,000. I don't think I need that. Like that's a pie in the sky of, I want a mobile clinic, right? And so, because that would be really an effective way to get out into our outlying communities and do a very fast, vaccination clinic, if you will, but that's a pie in the sky that may not, has to be like, priority, if you will, recognizing that there's so many other, pieces out there. And what is that process? So say I do want to come to you to be like, oh my gosh, I found the deal of the century. I think this will work. This is why, like, I'd like to get to that point, if you will, and wanting to recognize that, there's so many needs, and like, I think, it comes down to the board, right, in that respect. So I'm excited to hear there's some input, from other entities, if you will.
Mm-hmm. Yeah, I wonder what, can we have through the end of the year, correct, Kayla? Or do we anticipate that timeline changing?
No, December 31st is a pretty definite timeline for us to use that.
Yeah. I wonder if we, gosh, well, I mean, to me, for example, Colleen, just talking out loud on that, you know, a mobile clinic or some unit to reduce the risk of flu and COVID combined, right? I think you mentioned that earlier. Looking at that short term now for the season or through October, you know, is that a good way for us to look at that? You know, within the three month kind of chunks or 2 month periods. June, July. We're almost at the end of the year. Oh God.
No, I absolutely hear you. And I think, you know, depending on if it's actually something we can get and utilize, right? Because obviously the short-term strategy would truly be going out to to, you know, outlying communities, as well as having the ability to, you know, do, especially for our senior population, instead of trying to bring our seniors in to do a flu clinic, which we've done in the past, that, you know, we go to them kind of a thing. And granted, there's other ways that we can do it, but obviously, you know, ideally it'd be great to have something that we know that we would utilize for years to come. And I said, like, that could just be a pipe dream. I know that was the initial thought when we have our point of dispensing trailer, but that's, you know, that's a trailer that needs to be hitched up onto a vehicle that like public health doesn't own. And then we have to pull out, you know, other resources, if you will, to like, if we want to try to do that. And it's not, you know, it's kind of big and bulky versus something that's a little bit more streamlined. But like I said, like, you know, I can make that argument, but also at the same time, I recognize that I can also figure out other ways. I can pop up a canopy and I can make, you know, a clinic just as effective, weather dependent, right, as a way to do it. So, you know, obviously I have, you know, tons of different ways to look at things, but if there's opportunity and we're finding that we need, because we're not finding that we're gonna be able to spend this money out, that I just want that to have that opportunity to put something in there that I think I could probably acquire. And if not, I should know that quickly, because it's not as if, you know, we're not looking, if you will, considering some of the funding that we have. But
is that something specifically that we could rent a unit to do that over the next 3 or 4 weeks? And
yeah, no, that's a great question, and I think I will look into that. I love that.
And I like the idea to target or prioritize, you know, outlying communities, seniors, those who are or feel that they are at higher risk. Janine, did you want to say something?
So just a couple things. One is, thinking specifically about the communications piece, one of the goals of that subcommittee has been to try to come up with some structure and put it into place so that it can be used now and for however long recovery continues, and then also for future disasters. What we've discovered during this whole process, as I'm sure you know, is that we do not have a good system for communicating between local government and businesses. We have a spreadsheet of some businesses and some contact names, which is a little bit messy in and of itself. So it's definitely come up as a need, and I think we'll be talking about it in the after action review. So that, and we have heard, and the other thing is we do not have in here feedback from the business advocates yet. And so what we know will happen is that as all of that data comes in, there's going to be, you know, 4 to 5 items that rise to the top as the top priorities as well. So we are just projecting in this budget what some of those might look like, but it could be that there's an item or two there that really needs to be done right away to help businesses. And I don't even know what that might be. But one of the things that came up in some of the interviews I did were things like, hey, we need one source where businesses can go with a link on it to all the public health information, everything that's there, you know, like make it as easy and user-friendly as possible.
Yeah.
And so that could be something. I think that's the idea, is that it's meant to be a like super user-friendly, easy, and we've had discussions about what that might look like, but I think there's still some need for that. So when I asked that committee how CARES Act funding could help, that was one of the things they identified.
Yeah, and I think, oh, sorry, Janine, I think to add to that a little bit too is, you know, the business advocates are still very much in the infancy stage of collecting data. And gathering that data. It's not intended to be a process where, we just go in and ask questions and pull that data and put it into a spreadsheet and say it's good. We really want to be able to develop those relationships with the business community going into the long term, so that we do have an accurate projection of what's needed for them in the long term. So sorry, Janine, I did not mean to cut you off.
Oh, no, that's it. No, and I didn't mean to cut you off either. I mean, I think there's things on each one. I don't know on the business recovery grants, going back up to the top, if the city intends to try to do something like that on their own. If they don't with their portion of it, then I think it's appropriate that the county, cover that. But it just to make sure that there's not sort of a duplication of efforts in terms of they're going to try to do something for businesses as well. Is that something the county's agreeing to take care of? And we are assuming that that's going to be one of the top needs. We'll see what that looks like. And the timing of that, I think, will also be something to look at. And then I think Colleen did mention, and Colleen, maybe you can add the case management, the lodging and so forth. Did you say you have other funds for that, or you do need some of that in here? I can't remember.
No, so I do have, in the funding that I have that is set aside as part of our quarantine and isolation, the ability to pay for a hotel, but we don't have the ability to pay for out of the funding that I receive. And I'm guessing it's the same for your CARES funding. County, city folk is, paying for someone's rent. So there's, how do we figure that out? And so far, like I said, most folks who are offered possibility, what do you need resource wise, feels very comfortable. And I think I just would want to add, and kind of to the bigger picture piece, is that we know that the Office of Emergency Management, and many of you guys have participated as well, is working on that that communications plan in conjunction with the business advocates in that intent for that long term, how do we serve folks? And I think for me, not necessarily going line by line, but really figuring out that process for where the needs are. And like to Kayla's point, it's not just about, just gathering actually a few questions, but I think for us to really move forward, as a county, and or if the city wants to duplicate it, like a process that is in place that, so there's documentation of, hey, I requested this money because of this, the board, if there's a due date, everyone puts in what they think they need proposal wise, and then that truly becomes that board decision. And then that way there's a process, there's a timeline, and we feel confident that we can spend out that money. So maybe it's a super simple, 4 question, what is it? How much do you need? Can you spend it out? And, whatever. It's like super simple, so that we have a process in place. Mm-hmm. Everyone has the same shot at, coming to the board. Obviously, Janine and I, because we are in our positions currently in this pandemic, our voices feel a little elevated, if you will, versus some other folks that we may not be recognizing or had an opportunity yet to come to the table.
The last thing I wanted to ask, just going back to the overtime for exempt employees during emergencies, do you have a sense of what the timing is with the FEMA? I mean, are we continuing to track that? Are we, since we're under emergency, are we submitting at a certain point? And have you heard any word on when those reimbursements will get paid out? Because I know it was like a 3 or 4 year process the last time.
It was like 12 months last time.
Was it from the 2013 floods?
Not from the floods. We didn't have any wages from the floods.
Oh, okay. Okay. But do you have a sense of like how I guess that's my question. It's sort of a side question, but do you want us to keep tracking overtime, or since we're under a state of emergency, what are you putting in for your FEMA request? Is there a cutoff? Like it has definitely lessened, but it just depends on the week and what's going on. And
sorry, Janine.
Go ahead.
I was just saying, I'm up at the EOC with Kaylee, and she's going to jump in and I believe answer some of those questions, and I'm just going to step away. As we both have masks, but I want her to be able to get in there.
I just want to know. I can help with any of those as well. while this meeting was going on, I emailed our contact at DHSEM to ask about if they have any news on that actual timeline. So more to come, and I'll share that with you, but I can't really answer the question about tracking overtime. I think that's a bigger discussion on, you know, when is it absorbed into our jobs? And this is such a different incident that I'm just, you know, it's case by case, and it's so different, and now we don't have any kind of clear recommendations, but we have asked some questions to the state, and we'll share that when we hear back. It usually takes a couple of days to hear back, but I don't know if Sarah and Kayla wanna, if we have a timeline, we can say about overtime.
Yeah, I think back to just a brief comment that I maybe made earlier. I think that, you know, this, as public servants and in this pandemic, I think that's probably a conversation maybe we have at elected officials and directors meeting, just to kind of communicate to everybody that this, you know, there may be value in continuing to track that. Our expectation and anticipation is that those hours are significantly decreasing because this is our new normal, and now we've got, you know, we've just shifted priorities within our responsibility, individual responsibilities. So I think that what we might submit for will be for time towards the beginning, but I don't know that we will, and I mean, who knows if that funding is still going to be there through FEMA. So I don't think we're counting on that. As far as continuing like beyond and into 2020 and getting any reimbursement for overtime, I mean.
You mean 2021?
2021, yeah, thank you. Does that answer the question? And I'm not sure what the.
Go ahead, Janine.
Yeah, I think that would be good for a conversation. I just think some recognition of, you know, the 80, 90-hour weeks that folks put in, and asking them to wait 2 years to get compensated from that. If that's the structure that's set up during emergency, because I think it is just a factor to think about, and just to recognize, like, I don't do much of my regular job. I do all recovery and financial assistance in my time right now. So, I mean, I think the only regular thing I've done recently is help with Bright Start stuff, but to me, that's also sort of COVID related as well. So I think an assessment of that and how much it fits back into our work. And I have 2 staff. I have one person who does nothing but emergency management still, 40 hours a week, and could do more if I wouldn't cut off at that. So I think just some understanding of the ongoing workload related to that too is important. And I have a couple of exempt employees that I've been having to help them navigate so that they aren't overextending themselves, because we could easily keep doing that and just keeping up with it. So that's just a separate piece. But back to the conversation, what Colleen suggested, I don't know if you all want to form like some kind of a committee, or if you all are taking all of this in, or how you're getting feedback on how you want, like what your overall philosophy is for CARES Act funding. If you want us to give you that feedback, if you feel like you want to put it out to the community about what is the additional need so that nothing's missed, and then you take it through a funneled process, or if you feel like you already have a sense of that. If you want to, I don't think you want to wait too much on the business advocacy stuff, because as Kayla said, that's going to be an ongoing process. You want to probably leave some. Yeah. So, but the other thing is, we should probably start, allocating it. Do you say, here's some money to be spent on childcare that gets put with this entity, and tell us how you're going to spend it? that kind of thing? Or do you want it all to go through the county finance and then requests just come in through Crystal? So I think that's a whole thing. As those of us who have had money to distribute in the last 6 months can tell you, it's not as easy as it sounds sometimes.
Okay. I think we have kind of a lot of different paths that we can consider with what way we want to take the CARES funding. What are your thoughts, Sarah?
I'm trying to think of maybe buckets where we create a process either for each one, county department services and needs, county investment and resiliency, business advocacy, unemployment and casework. I'm not.
Are you talking about allocating to folks that are unemployed?
Yeah, or resources and kind of mass care targeted to support those folks.
Go ahead, Janine.
Sure, we do have about 60,000 out there still for that. And then the case manager who's working with folks at Full Circle is also helping folks find those resources when they don't fit the existing criteria for what's out there. That is not an unmet need at this time, I think it's fair to say. Would you say, Colleen?
Yes and no. I think it really depends on, what continues to open up. But I think what we're finding because now we've both been, beyond knee deep in the unmet needs committee, is what we're finding is the funding that we are getting to help support folks who continue to not, have the opportunity for jobs for one, reason or another, be it, COVID-19 specific, is, being able to pay rent, because a lot of the funding we're getting is like restricted versus something that's unrestricted. So I don't know if that's an opportunity for, how we kind of, kind of solve that piece, and, knowing, which we know that we've been very effective, to be like, we need to spend this, amount out by this date. That funding goes to the front of the line, et cetera, et cetera. So that might be a better use versus like an unemployment specific piece.
Okay. That makes sense. Sorry, just trying to catch up on writing notes down here. I don't think I have anything. Go ahead, Sarah.
I'm looking at that Sims project. Janine, do you know when and how that process can and will be initiated?
Yeah, so Judge Seamus was going to double check with the contractors to find out what amount. Originally, that was the amount they had told him, and I think it would be August. So we're looking at trying to do that, and then we had talked specifically about trying to track this impact of COVID, which we are seeing in families, and I think he may be seeing it to some degree, but people still aren't as active in court. I mean, it's having a significant mental health impact on families and kids. I think that's another thing related to that could show up in this SIMS mapping, but that's related to going back to school, is what does that transition look like? Because it has really impacted kids in terms of their social interactions, just transitioning away from, like, if their home environment was the only thing they've been exposed to for a significant amount of time. And the Sims mapping would capture a little bit of that in terms of what are the gaps in our community, what do we need to be putting in place that is going to need to meet those needs. And some of them are pre-COVID, but a lot of them, I think, as we look now, are going to be post-COVID specific, really, which is very interesting. Folks are still not back to work. How are we helping them cope from a mental health perspective? We've got a significant impact of, like, just ICE involvement in the community. We've had, like, intense impact on youth with fear of deportation, and just things like that. We've really got to look at what are our specific needs and our gaps related to that.
So Kaylee has reached out to the state to understand the FEMA piece. Kaylee, when we hear back from you about that, then we can make some decisions around some of what we were hoping to have reimbursed through FEMA and see what we can take from CARES Act at that point. Because I think that they're really two separate buckets.
I also think I'd like to go through this and maybe create a living document of my own for us to talk about at the end of the week or next week at the same time. See what the city, I think that they're meeting tonight. I wonder if I don't know what's on their agenda, if anybody joining happens to know. But, like Janine said, let's not duplicate those efforts if that's not necessary.
Okay. Sounds good. I have a 3 o'clock meeting. Is there anything, what kind of deliverables can we put on this and meet again about it in a week?
I can reach out to the city and get, what plans they might be proposing or considering. I can kind of outline some opportunities and projects that I have been continuing to work on, or that have been, come to light in the last couple of weeks. And I think that we need to maybe really think about how we, like Colleen and Janine are saying, how are we creating that process if it is not only board allocation, either to inform the board or advise the board, or create a committee to make any of those decisions on any amount of this funding.
Sounds good. Oh, sorry. Do you want to create that living document, Sarah, and share it with the board and maybe directors and elected officials? And then that way we can we put it on our Teams network and upload documents into that place so that everything is together for us to talk through this? I'd like to bring some of this back next Tuesday and at least have some outline of a process cut out a little bit.
Yeah, I can work on getting that started. And I apologize. There's a lot going through my head right now. I'm trying to organize this stuff, and I'm not sure talking it out at this moment is anymore is helpful.
Yeah, this is a pretty big undertaking, and there's a lot of moving pieces through the recovery that I think we need to consider. Janine, can you and I have a conversation in the next couple days about recovery impacts potentially?
Sure. Yeah.
Okay, that'd be great. Wonderful. Well, thank you guys so much for putting that together, having that that potential budget sent to us to give us some time to consider things and think about things. And then would it be okay, would it be appropriate, Sarah, for us to put this on our work session for next Tuesday? Okay, so we'll come back to this next Tuesday. If you guys would like to join us again next Tuesday and go through that document that Sarah's going to upload and any further information that we might have a week from now. Does that sound appropriate? Yeah. All right. Does anybody have anything else before we adjourn today? No?
I don't. Thank you, Kayla.
Thank you,
Thanks.
guys.
Thank you. Thanks, everyone. We appreciate your time and work on this.